you've probably heard of the endocannabinoid system, or the ECS, as we call it. And, and I just want to very briefly talk about how that works, because it's important to understand that we have an endocannabinoid system. All vertebrates and invertebrates, for that matter, have one. And we make our own products that are, or compounds that are very similar to CBD or THC ourselves. So we have receptors. The two receptors that have really been identified to date are CB1 and CB2. They're spread in different places in the body, but CB1 is mainly in the brain. CB2 we think about more as being in the periphery. But again, you can find both receptors in most any part of the body. Dogs are the same as people. They have the same types of receptors. And then we have these endocannabinoids. So the endocannabinoids are the cannabinoids that our body naturally makes. And there are two that have been identified. Anandamide is one, and that's really called the bliss molecule. One of the first that was identified, and then 2-arachidonoglycerol, or 2-AG, is the other one. And then we naturally have some enzymes that deactivate those compounds once they're produced. So they're very short-term compounds, and then they get released on demand, and then they get deactivated. So I threw this slide in here because I think it might help explain why dogs are so much more sensitive to THC than people are. You look at these dots are representative of the number of receptors in the different parts of the brain. And so you can see the cerebellum of dogs have quite a few receptors, CB1 primarily, but some CB2 as well. And then if you look brainstem in people, the number of receptors are much smaller. Brainstem, cerebellum, brainstem pretty similar, but cerebellum is definitely different. And that might account for part of the reason that dogs seem so much more sensitive to THC containing products, is they just have more receptors in their cerebellum. So that can account for making them what we call ataxic. It means makes them wobbly, which is one of the signs that we see in dogs that have THC toxicity. So number of receptors is probably, at least in part, what is responsible for the differences in how dogs and people react to these different products.
So if I'm hearing you correctly, THC can be toxic in dogs, and CBD, we at relatively similar levels is not toxic to dogs. So there's really lower risk. Is that fair to say?
Yeah, Sean, that's exactly right. So THC can be toxic. Since marijuana was legalized, as a veterinarian, we see a lot more animals coming in with marijuana toxicity, THC toxicity, but we don't see dogs coming in with CBD toxicity, hemp toxicity. That just is incredibly rare. It doesn't happen.
Understood. Thank you.